All right. Well, good morning. Good morning. Good morning. Good Saturday morning to you. You have just tuned in to a community conversation about health and research. My name is Chris Howell, and we're delighted to host this conversation here today in collaboration with the Community Council of Greater Dallas. It's a great partnership that we have formed to really try and educate our community and raise awareness about health and research. So buckle in your seatbelt for the next hour and 15 minutes or so. I'm surrounded by a group of experts who are really going to help us to unpack this conversation. So delighted to introduce you to each one of them. But joining us this morning to help kick this whole conversation off is a young man who I met this week. And man, I'm just excited about his energy level, his passion for informing our community and making sure that our communities are informed and well equipped about all the things they need to know regarding health and research. He's a community relations assistant over at the Community Council of Greater Dallas. And I'm delighted to introduce you to Miguel Trejo. Miguel, take it away.
Thank you so much, Chris. I appreciate that amazing introduction. I couldn't have said it better myself. But alrighty, let's get this show started here. So again, thank you to everyone joining us today. We're here live with the man himself, Chris Howell, and our other amazing panelists to have a very informative discussion regarding the important role that research plays in helping us and future generations to live better and healthier lives. Our topic for today is a community conversation about health and research. And just want to say, this topic is especially important this month as we recognize Breast Cancer Awareness Month. My name is Mike Trejo, and I serve as a marketing program assistant with the Community Council of Greater Dallas, assisting the All of Us research program. I want to encourage everyone to like and share our Facebook Live video, as well as send any questions you have to the chat box. Just to give a brief overview of our Community Council, we have been serving the Dallas area for over 80 years. Our mission is to improve the quality of life of individuals by alleviating poverty, fostering independence and wellness, and connecting people to the resources they need. Some of our programs that we offer are 211, which is information and referral system to connect individuals to needed resources and services. We also have the Community Service Block Grant, or the CSBG. It's a program designed to move individuals out of poverty by helping them build better opportunities through work, career, education, childcare, and transportation, just to name a few. Then we have the Dallas Area Agency on Aging, which is a program in which we provide older adults with care coordination, family caregiver support, benefits counseling, transportation, and evidence-based program classes. We contract with agencies to deliver meals to homes and provide caregiver support throughout the Dallas County. Then we have the Community's Wellness Program. These are programs where we promote healthy living through self-management classes addressing diabetes, chronic disease, chronic pain, falls prevention, stress busters for caregivers, medication reviews, and lastly, in 2017, the National Institutes of Health launched the All of Us Research Program, which we are extremely proud to be a part of. The All of Us Research Program is inviting 1 million people across the U.S. to help build one of the most diverse health databases in history. This robust database will help researchers learn factors that impact our health and learn new ways to treat and prevent disease. During these challenging times, it's important that we also do our part to help stop the spread of COVID-19. In joining the All of Us Research Program, you can help change the future of health. I am, again, so excited about today's program, and I would like to turn it over back to Chris.
All right, Miguel, thank you so much for that wonderful introduction. Again, you can feel his energy. This young man is excited about the work that he does to make sure that our community is informed about health and research. As I mentioned a moment ago, and we've got a number of experts on deck with us today to help us to unpack this topic, so let me introduce you to our panel. First and foremost, we have Jennifer M. Jones, also known as JJ. So throughout the program, she said, I asked me to refer to her as JJ, so we're going to refer to her as JJ. But Jennifer M. Jones is the Executive Director of Student Development at Southern Methodist University, where she has been employed for over 30 years, 16 of those years in various positions within residence, life, and student housing. She is presently the immediate past president of the National Panhellenic Council and also served as the past first vice president of the National Panhellenic Council and regional secretary for the Southwestern region of NPHC. She is the program lead for the Black Greek Letter Consortium in partnership with the All of Us Research Program, which we're discussing here today. Ms. Jennifer Jones received her BA in Sociology and a Master of Liberal Arts from Southern Methodist University. She's an author, a wife, a mother, and a grandmother, and we're glad to have her here with us today. And again, as I mentioned a moment ago, she's with the Black Greek Letter Consortium, which is also a collaborator with us here today, so we're certainly appreciative of them. Jennifer, welcome to the show. Absolutely, Jennifer. Now, as we get into this, let's first of all tell the folks a little bit about your experience as it relates to the things that we're going to be discussing here today.
Oh my goodness. So MPHC, which is a traditionally African-American people-led organization.
Pull that mic just a little bit closer to you, Jennifer. He's going to give me some volume there, but pull it a little bit closer. There you are.
That's good? Okay.
All right. I think I can hear you a little better now.
Okay. So the Council of Presidents, who oversee all of our national Greek letter organizations, the All of Us program reached out to us to become a partner. And I was the president at the time, and so we decided this was needed, and we wanted to be a part of this wonderful opportunity. And so, as the president, became the program lead for the program, and we've been a part of the program for 4 years now.
Wow.
And then this, as we began to become a partner, I was diagnosed for the second time with breast cancer. The exact same day we had our first meeting. And so now this program and this initiative has become very personal for me.
Yes.
Because I've learned so much by being a part of the program, and about research and my taking part of research, and about my body.
Yes.
And usually in our community, the Black community in particular, we just listen and we don't ask questions. And from this program, I've learned to ask questions about myself and what's going on with my health. So I'm a champion for my own health now.
Absolutely. Thank you so much for doing it. And now you're also advocating for other people as well.
Absolutely.
So we appreciate that. And as you mentioned, it is Breast Cancer Awareness Month. We're in the final 2 days of Breast Cancer Awareness Month. I do want to unpack that a little bit more once we come back to you, because I think it's, while we may end this month in terms of awareness, we do want to continue that as we continue to go. Yes. So we'll be back to you in just a moment. All right. So right now, next up, she is so fly. I'm looking at her with her sunglasses on. I'm like, man, she is so fly. The lady sitting there with the sunglasses on is Dr. Chrisette Dharma, who has a no stone left unturned philosophy to medicine, which has earned her a strong following of patients. She also believes that prevention is the key to good health, which led her to establish an on-site wellness center in 2014. Her dedication to medicine is represented by the multiple board positions she has held, including president of her local chapter to being on the board of the Texas Academy of Family Physicians. As an associate clinical faculty member at UT Southwestern, she has taught medical students for over 20 years. She is now spending her time in advancing medicine through multiple studies conducted at her facility. As the principal investigator at Southwest Family Medicine Associates, she was selected as a clinical site to investigate the effectiveness of the different medicines to treat COVID-19. She is committed to saving one life at a time, especially in communities that have been hardest hit by this pandemic. Please welcome the fly girl, Dr. Chrisette Dharma. And also, again, Southwest Family Medicine is also a collaborator today. So thank you for being here.
Yeah.
Tell us a little bit about, again, I've read your bio. You've got a number of accolades, but tell us about your experience and how you're going to relate to today's conversation.
I think how I'd relate to today's conversation is that we do clinical research at our facility. So every day we talk to our patients not only about drugs that are currently on the market that can help them, but also new advances that we have open to them. And as you pointed out, one of the things that I'm most proud of right now is that we were one of the sites selected in the United States to do the trials on monoclonal antibodies. And that has become a life-saving treatment for patients who have COVID. And so to see it in action from its infancy and the early part of this year to now being fully available in all of the different facilities is amazing. I mean, I just feel like, that I really put a mark on what's going on today. And so I feel very honored to be part of research. And so I think it's really important because, as you said, JJ, I think one of the biggest things that we see is the lack of minority support, initiatives, involvement in research, which leaves them behind. And as a minority, I don't want to be left behind, and I don't want to leave my brothers and sisters behind.
Yeah, absolutely. Man, it's extremely important. And I wanted to just, before we introduce Dr. Kitzman, I want to make sure that today is an interactive conversation. We do want you to ask questions. One of the things JJ talked about a moment ago is many times we just listen and we don't ask questions. Mm-hmm. This is an opportunity for you to ask the questions that you have of all the experts that we have here today, whether you're viewing us on Zoom, whether you're on Facebook. Again, please make sure you chime in with your questions. Even if you can't stay the entire hour and 15 minutes, go ahead and ask your question. We will then make sure we get it answered, and then you can always come back and get that answer in the replay, or you can get it in the chat box. So again, whether you're on Facebook or whether you're on Zoom, be sure to ask your questions. Next up is our expert. Dr. Kitzman is the research director at Baylor Scott & White Health and Wellness Center, and she conducts federally funded research to evaluate real-world innovations to improve health outcomes in low and uninsured populations. Dr. Kitzman, welcome to the show.
Thank you for having me.
Absolutely. Talk about what your involvement with this All of Us research program.
So I've been with All of Us since the very beginning. I'm a co-investigator and the site lead for the Health and Wellness Center, which is a community-based primary care clinic and wellness center in South Dallas. It's at the Juanita J. Craft Recreation Center. So we're a private-public partnership with the City of Dallas, Baylor Scott and White Health, and HTPN is our primary care clinic that's on site. So we're right there embedded in the South Dallas community. So when people do want to participate in all of us or any of our research initiatives, we're right there in their community. We also do a lot of stuff out in the community at churches and other rec centers, health fairs, because not everybody has the ability or the time to drive to a clinic across town to participate in a research study, or they may not feel comfortable. So I've been with all of us since the very beginning and really championing to make sure that with all my studies that we include people that are low income and underrepresented, particularly in research studies. And that kind of goes across the racial ethnic span from white to black to Hispanic. We want all of us, which is all of us. We want all of us really to participate. And we can talk about why it's important, as the show goes on. But really, I've been working with low-income populations for about 20 years doing federally funded research at the community, clinic, school, and church level.
Good deal, good deal. Well, thank you so much for being here today, and thank you for what you guys are doing.
Yeah.
I want to ask the guys if they'll put up the enrollment form. We want to do that early on, and we're going to put this up several times throughout the program, but we will put up the enrollment form for those of you who may not be able to stay with us. If you want to get involved in the research study, here's your opportunity. Take your phone out, take a picture. If you're viewing from something else, take a picture of that. Make sure you have that information because, again, you have the opportunity to get enrolled. Maybe you have questions. You want to get additional questions answered. Make sure you, again, take the advantage of the information that's on your screen now. Jennifer, I want to come back to you. Again, as we talked about, it is Breast Cancer Awareness Month. And then you talked about the fact that you had breast cancer. Let's talk about what it was that you learned from that you feel like others could really benefit from.
The first thing was that the medications or the treatments that I was given wasn't working for me. And an example of that was I had neuropathy really bad in my feet and in my hands. And they gave me all these things to do. One of the things that I had to do was put my hands.
Excuse me 1 second, Jennifer. I'm not certain that they're hearing you because I'm barely hearing you. Are we good on Jennifer's mic? I just want to make sure that we don't miss the information. Pull it a little bit closer to you. Now, let's go. Let's try that now. Let's go. All right. I want to make sure that we don't miss the information there.
So the neuropathy. So when I was having chemo, I had to put my hands and my feet inside of ice for the entire time that I was doing it, and it didn't help me. And they literally both times, when the first time that I was diagnosed and the second time, it didn't work, and so they had to stop my chemo. And that worked. my feet are still kind of off, but I learned that it wasn't for me, and I was trying to figure that out. And as I said, the second time that I was diagnosed, I was a part of the program, and I began to ask questions like, why is this working? And then I even went to my oncologist and said, have you heard about this program? And she hadn't. So I sent all the information to her so she can help me.
Yeah.
But I really learned about the importance of being a part of research and understanding that, because if the treatments are being based on a white woman, I'm not a white woman. And my makeup is totally different. And I had the triple negative, like they really, literally my doctors was like, oh my gosh, she's not gonna live in their mind. And I did. And because I didn't take all the things that they told me to take, because it just didn't make sense. And it had to make sense to me. And being a part of the program, I asked questions. Why am I taking this? This isn't going on with me. Because they had this regime. This is going to happen. This is going to happen. This is going to happen.
Yeah.
That didn't happen to me. So but you still want me to take the medication? Why? So I never did. I was even told I was under medicating myself. I never had nausea. I never had any of that. I had 7 rounds of chemo the first time, and the first 34 rounds of radiation. And none of the things happened to me. So I learned that, it has to be a fit. It absolutely has to be.
Let's do this. It's not your mic. It's not that it's too low. We're going to come back to you in just a second. Let's go to Dr. Dormer real quick, and I'm going to let the guys figure out what's going on with your mic there. It's not that it's too low. Something's going on there. Dr. Dormer, you heard JJ talk about her experience. Let's talk about, in this month of breast cancer awareness, again, the importance of the early detection and making sure that we're doing those regular doctor visits, things of that nature.
So, with COVID, everyone is so concerned about utilizing the healthcare systems that prevention has kind of flown out the window. Mammograms is the easiest and best way to get early detection. And so, how do we get people past just simple barriers like, they didn't want to get their boobie squished, right? So they're like, that's going to hurt. I'm like, Yes, only for a second. And so sometimes it's just that basic. It's always covered under their insurance because it's a preventive screening. Is that how yours was found?
Yes.
Yeah.
Well, I actually found my own lump.
You found your own lump? Okay. And so then that's unfortunate because like by then, if you can feel a lump, that's not a good sign versus finding microscopically and getting it early, you're going to have a much better chance of cure. And so your point also was that the same things that work on, and I want to say it in the most PC way that I can, which it's not possible, is like white breast cancer, is not the same that's going to work on someone who is of a different nationality or descent. And so that is the whole point that we're trying to teach people with research in regards to if you don't participate, and you might think, this doesn't have anything to do with me. I don't have breast cancer or I don't have any diseases. But at the end of the day, someone in your family did. And so how do you just totally not engage or involve yourself in some way, even if the way is just to learn about what research is available? What I find interesting is that people, if it is cancer, will be more open to doing research versus if it is something else. But the reality, so if you're like, oh, there's a new medicine for diabetes. They're like, oh, no, I'm not interested. I don't want to be tested on, But the medicine that you're on right now, somebody was tested on it, that's what they don't seem to quite grasp. And the newer medicines are actually better. That's why they created them, because those old medicines had side effects. They might not have been as effective. And so the most that when things come out into research areas like where we are PIs, they're in phase 2 or 3 trials, which means that they've already been tested on animals for adverse effects. Now they're usually being studied for efficacy, and that's just a big word to mean how good is it, So I think sometimes people don't understand that it's not we're using you as a guinea pig. We're actually seeing if this drug is going to be effective and how effective it's going to be, how many people it's going to help. And so I think that is really important. There was actually a drug called Bidil. And the interesting thing, it was studied on everybody, but the only people it helped was African Americans. And so then it came out into this really niche audience, which it wasn't very useful or utilized, because it was like, oh, only if you have this disease and you're African American did it show that it helped. But the reason I bring that up is because think of that on the opposite side. With all the other people, you have all these other drugs. Well, what if you're on a drug and you're African American or you're Hispanic and it doesn't actually work on you? But
Right.
because all of the studies that we did were on white people, we're just drugging you up, right?
Yeah.
So then you say, well, why should I be the one? And I was talking earlier before y'all kind of joined us. A patient the other day, he said, well, I don't want to help. I mean, that was their answer. Well, I don't want to participate in helping other people. Right. It's unfortunate, except that he was actually utilizing a drug that we did studies on, 6 months ago in order to save his life
So
today.
someone helped you to be able to get to where you are.
But yeah.
Yeah. So wow.
I think there's a lot of really good points that she brought up, especially around the whole guinea pig thing. So we've enrolled thousands at this point, maybe 3,000 African American and Hispanics in not clinical trials, randomized trials. We do have some drug trials, but they're actually effectiveness or pragmatic trials, which is a little bit different. And one of the things that we do to get people to understand the value of research is we have a lot of community health workers that work on my team. They're culturally relevant. They understand the questions that folks have, and they can respond in a way that shows that they understand the mistrust, right? And so where does that mistrust come from? We all know about Tuskegee and the things that happened in the past. And I think that whole guinea pig concept, which I hear a lot, is lower income individuals in the South Dallas community feel like we are doing research on them that we wouldn't do in a middle class population, regardless of ethnicity. And that's actually not true anymore, but it was true at one time. So we have to be able to say, yes, that did happen in the past, that studies were done on African Americans and low income people that they wouldn't do in a white or a middle class population. But that's not allowed anymore. Right. And now it's because of the way the population has shifted in terms of demographics. We need African Americans and Hispanics to participate so that we know what we're developing works for everybody.
Yeah.
And one issue with our drug trials is they don't stratify the results based on race all the time. There may not be enough sample size
There's
to say.
not enough sample size.
Exactly. That, okay, we're looking at this breast cancer drug and we want to see how does it affect Black women between the ages of 40 and 60. There's not enough Black women enrolled in the study to look at them separately. Yeah. So they have minority targets often, sometimes not. But it's not enough for us to really understand how does that drug work for this specific population. And that's why All of Us is so amazing.
Yeah. Yeah. And I want to come back to that in just a moment. I want to go back to JJ because we couldn't get our mic going there, but I want to come back to talk about how you guys are helping to overcome the barriers. I think that acknowledgement of what happened in the past is first and foremost. I think that's a good point, but I want to pick back up on that.
Absolutely.
JJ, back to you. How have you taken your personal experience to help others to understand the importance of research?
I tell the story. I mean, being like, again, this program, this initiative had become personal. Yeah. So wherever I'm given the opportunity to share, that's what I do. Actually, after I leave here, I'm going to talk about it again because it's important. It's so important. And my mother died of cancer. My father died of cancer. My first husband died at 34 of cancer. And when I was diagnosed the second time, my young brother was diagnosed at the same time. Like he was like 2 months prior to me. And he succumbed to it. And I did the genealogical test. They told me I wasn't even prone to have cancer, and it wasn't hereditary, but it was environmental. And so those are some of the things that we don't know about, that the places that we live and grow up with has something to do with our health. Yep. And we don't know that. We just, you know,
the food that we eat.
Yeah, the food that we eat.
The air, the water.
Yes.
So would you say that's even more of a reason to be involved in the research because of the fact that, again, we don't think that about that environmental aspect of it?
Absolutely. We don't understand the connections that all of the things, genetic, yes. Then there's the environment. There's where you live. I mean, it's a lot of things that go into that, but we don't realize that because of the fear that you talked about. But yes, putting that fear out in front, because we've actually done workshops where we've shown Henrietta Lack's movie to get it out there. Okay, here, this is what it is. Yeah. But then after the movie and after the conversations, people's like, oh my goodness, I never thought about this. You know, we don't, because that fear just keeps us from moving, and we become stagnant. We don't do anything. Yeah. But when my daughter came to me and asked the question, am I gonna die of cancer? Am I gonna get cancer? That just blew my mind. I'm like, oh my God, I don't know. Like I don't know. Yeah. But whatever I can do, they may not find the cure or be able to help me right now in my state. But my daughter, her son, generations to come, it's our duty to be a part of this, to make the difference or find the answers that we need for our community.
Yep. Yeah. I love the way you talked about that. Sometimes it's not just about us, but it's about thinking about leaving something for that next generation. Yes. We're always thinking about leaving cars, houses, things of that nature. Let's leave some good health.
Leave your health story. Leave your health story. So something, Big Mama died of something, but we don't know what that was. You know, when she died of the pressure, whatever we called it, because we have names for all of these things, and we don't know what that means. Right. Or they keep it a secret. My great-grandfather died of syphilis. I don't know if he was a part of that. It was around the era when he was born. I have no earthly idea, because my parents didn't want to tell that. You know, you keep the little secrets. Yeah. But health secrets, that affects our generations to come in within our families, and we have to talk about it.
Yes. I like the way you said to tell your health story, because a lot of times, people come in and they're like, well, they died of cancer. I'm like, what kind? Because it matters, because, some are inherited and others are not, and others are related to environment and or behaviors such as smoking. And so when they're like, well, it was all over their body, I'm like, okay, well, that's so not helpful. So it's really important to kind of share your health story and to document it and to be transparent and open, and especially about mental disease. That was an interesting point, because again, like in minority communities, there is so much mental disease that's just kind of swept under the rug, and nobody ever talks about it. And in that way, you know, it's so behind what the conversations that we have with the general population. I mean, I have to like separate and think, okay, I'm talking to someone who believes that besides, you know, God's word, that counselors are not helpful, you know, and so because in their family, those things were not appreciated, you know, and so it's really like you have to start at a whole different level. While if I have a Caucasian patient come in, then I'm like, well, do you want to see a counselor? They're like, oh yeah, or do you want this medicine, you know, and they've already read about it, while an African American person thinks of it as a real, like, not, I don't know how to put the word, but
it's all the stigma and everything.
It's stigma,
Right,
yeah. That's you're right,
Yeah,
Chris.
you're going to be stigmatized, you know, because you're going to see a counselor. I'm crazy. No,
Right.
you're
Yeah,
not crazy.
right.
You're
That's
smart,
right.
actually, to go and see a
Right.
counselor to
Yeah.
get the help that you need. Yeah.
And then when they ask their family, they're like, "Oh, you don't need that. You know,
Exactly.
you do not need that. You just pray about it, and you're gonna be fine." You know.
Because they don't want the stigma associated with the family.
Right.
You got that cousin who's crazy. You know, we
Right.
really,
And this-
right. That's part of what we're working here to overcome today
Yes.
with this conversation.
Yes.
In just a moment, we went out on the street and we talked to some guys out on the street just to try to get a sense of what it was folks feel about research. I'm going to play one of those videos for you. We're going to come back and we're going to find
Awesome.
out more about why we're here today and the
Okay.
conversation we're having. Take a look at this video. We'll be right back.
No, I didn't know it, but I wouldn't take it no way.
No? Why you feel? Why is that?
No, you just don't take something just because they say something. No. Now, I took the vaccination shot. Yeah, I did that because they're scientists. And that's it.
So pharmaceutical companies, though, it's based in science, it's based in research, but having African Americans as a part of the study helps us be included in the
guess
medical
they're the guinea
formulations
pigs.
for us. Huh?
I guess they the guinea pigs then.
Okay, so it's a no for you?
Yeah.
But you do believe in the COVID vaccine and you took that?
Yeah. Yeah.
Okay, great. Thank you. Have a nice day.
All right, all right. So you guys heard it. Again, I want to come back and I want to do a reset because we've had a number of people to join us in the conversation.
All right.
First of all, when you hear him talk about this, I want to delve into the fact how he separated science and government.
Right.
And I want to delve into that point.
Yeah.
But before we get into that, tell us what is the mission of the All of Us research program for those who just joined us?
All right. So the mission of All of Us is to recruit 1 million people across the United States and collect samples from them. So we collect blood that is sent to the Mayo Clinic and their genomic sequencing is processed. We also get permission to collect their electronic health record information. So what diseases they've had, what drugs they've been on. We also know where they live, so we can look at environmental factors like water, air pollution. All of that is put into a giant database, and of course, it is de-identified. That's always a concern, is confidentiality. They have a great pictorial on how they take the data and put it here and there and here and make it so that nobody knows whose data it is. And then that database is opened up to researchers all over the world. So because a normal research study, like the ones that you conduct, Dr. Dharma, is people show up, they sign up for a study, they get an intervention, a drug, whatever. They finish, they get measured, they get a gift card, they're done. All of us isn't like that. All of us is a different type of study. It's a precision medicine initiative. So we need data from as many different kinds of people from across the country as possible so that when a researcher goes in there, let's say it's an endocrinologist, and they're looking at genetic factors related to diabetes, they can pull all that data out and analyze it from their expertise to try to figure out which medications for this type of person living in this region work the best to manage type 2 diabetes. Those are the types of questions that we can answer. What's hard to explain is we don't know what people are going to find from all of us, right? The initiative is to collect the data and then hope that we get some amazing findings. I think the fact that they used All of Us data to find out that COVID was in the United States in December, that made me so proud that the people that we recruited got to, be a part of that. That's the blood samples they used to find out that COVID was in the United States in December. So that's just one of, I think, 1,000 innovations that are going to come out of this study.
Absolutely. Well, thank you so much. And again, if you just joined us, you're listening to a conversation about health and research. You just heard from Dr. Heather Kitzman. She's the research director at Baylor Scott and White Health and Wellness Center. It's a partnership today between Chris Howell Communications and the Community Council of Greater Dallas. So again, if you missed any part of the conversation, I want to ask you to go to ccadvance.org. That's the website for Community Council of Greater Dallas. You can get more information regarding the All of Us Research Program, as well as you'll be able to catch the full recap of our conversation here today at ccadvance.org. All right, we just looked at the Man on the Street interview. Dr. Dormer, I want to now come to you. During our pre-meeting yesterday, you brought up a very good point, how many times folks have a hard time separating science and government. I think we saw that in our Man on the Street interview today.
Yeah.
Help us to understand the difference when it comes to research and medicine and things of that nature. How do we separate the two?
Well, first of all, research is founded in medicine and science. I mean, I don't have any connection to any part of the government, you know. Now, sometimes there are governmental organizations that do research, like the NIH, you know, and obviously those are heavily regulated. But I also want to make sure that people understand that when you talk about research, sometimes they also think about the pharmaceutical companies who are like Big Brother, not necessarily government, whose aim is only to, you know, make money, put us on a bunch of drugs, and financially profit, you know. So, I mean, I don't know that that's not true. I think that is true. You know, I mean, pharmaceutical companies have a financial incentive to try to put out new drugs. And then the new drugs sometimes can be exorbitantly expensive, right? So $1,000 for HIV drugs. But people in the 1980s died. You know, that was $1,000 a month. Okay, people were dying before that. So, you know, there are lots of, I think, incentives for government, pharmaceutical companies. You know, everyone has an agenda. And I think that is so important to talk about, because when you don't talk about the fact that there's agendas, then people feel like you're not telling them the truth, you know? Right. In addition, you know, you get paid for research. I don't think people necessarily always talk about that. I mean, I remember in college when everyone would donate plasma and that would get them through a few meals, you know? And so, you know, you do get paid for research, but we don't really talk about that because that should not be the driving force. Yeah. You know, the reason that you get paid is it's your time, it's your effort, you know,
it's a thank you.
And so, you know, I had a patient that I just talked to about getting a Cologuard test. We're doing a research study at our office on anyone who's over 65. And so they get the Cologuard test for free. They get paid to do it. And then they get the colonoscopy, which they were going to do anyway.
Right.
You know, so, I mean, research is part of usually what she referred to was that, you know, there are drugs that are already on the market and you're looking to see if they work and how well they work. So sometimes we use words like efficacy and we're like, oh, what's efficacy? And it's just like, hey, we want to show you that this drug helps 90% of people get over COVID versus, you know, oh, it only helps 30%. Because then you're like, oh, well, I want the 90% drug. I don't want a 30% drug, you know? And I thought she made so many good comments that, you know, sometimes you just like when you're talking, you don't catch all of them. But she said a really important word, which was precision medicine.
Absolutely.
And I want us to just hone in on that for a second, because it was just like blah, 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 precision medicine, blah, blah, blah. And I was like, oh, what's precision medicine? I'd like to know a little bit more about that, you know? And so that is the wave of the future, right? So when I talk to patients and I'm like, you know, I really think this drug would help you, again, that might have only been studied on 10 black people and 1,000 white people. And I'm like, I think this drug's going to help you. And do I even know that? No. They don't separate that out because they don't want people to know that, hey, we didn't get enough black people or Hispanic people or Asian people to enter the trial. So we're just assuming that it works on
the
you.
Same for everybody.
And I don't know if y'all know, but like in blood work, when we check someone's kidney function, we actually separate out, and it says like what your creatinine is, which is how good your kidneys are functioning, and it says, and what your GFR, which is how well it processes. And so it's like if you are white or non-black, or if you are African American. So we literally have done such specific studies, and they're different numbers. So we know that precision medicine is really important for us to understand the difference. And I think, it's much harder for what I do than what she does, because I'm asking you to take a drug.
Yeah.
She's only asking you to try to care about your future generations, try to be involved in your community, try to get information for yourself, that will make a difference in the fingerprint that we leave behind. And the way, that we do that is by understanding, it's 1 million people across the whole United States. So, when there is a higher incidence of breast cancer in Detroit, what was that due to, because that doesn't necessarily apply to us when we live in Texas, and then I think another important thing is that we all, like my patients and I, believe in some alternative medicine and integrating, which it sounds like, JJ, you've been doing. And, how does that impact you? Because, wow, your blood is so much better, and you haven't gotten any disease. Hell, what have you been doing? Because we want to know. And so then that's the way that we're able to understand. So this All of Us project is just basically asking you to be a good citizen, and to be part of the million, to help us include, I think you're not supposed to say colored people, right? But I'm like, well, I'm a colored person, so I don't know what to call me.
People of color.
People of color. Okay. So, I'm like,
Don't say that.
You're going to turn it into a whole nother show. Let me come to JJ real quick. JJ, so talk about, when you talk about precision medicine, talk about you've done a number of projects with Community Council of Greater Dallas. Talk about some of the things you guys have done to really try to help folks overcome some of the personal barriers.
Yeah, it's been the showing of the Henry Lex movie, and then having a panel with doctors that does research that can be able to answer the questions about that. But it's just, people just don't know. Like, they absolutely do not know. They don't understand precision medicine. They understand the concept. So we give examples like your prescription glasses. So I may have a prescription and wear glasses, and you don't take my son's eyes to the doctor to get my prescription. You use my eyes. So it should be the same thing for health in your diagnosis and those kinds of things. So we've done so many things in reaching out to the people to make them engaging them and educating them on the program. And we haven't been just like, okay, sign up, but that's part of it. But it's more so being a champion of your own health. What does that mean? That means understanding that you need to be a part of the difference. Because even in this, if they get 1 million people, even if all of us succeed in the 10 years and get the 1 million people, how many of those are going to be people of color? It still may not help in the long run, because they still need a big enough size sample to be able to do all the work that they do. So we're trying to get the numbers up.
So JJ, I think, when you look at the numbers in Texas, so Baylor Scott and White Health is the only health partner in Texas recruiting for all of us. And we've recruited about, there are other people recruiting. I think a new health partner started in Houston, but we're the main one in Texas. So if you look at our numbers, we have about 40,000 that we've enrolled. And out of those, only 1,200 have come from South Dallas. Wow. So for every 10 people they get in Plano, I have to work 3 times as hard to get 5 in South Dallas, because we have to address all of the mistrust, the confusion between government and science, so many different factors. But a lot of it is mistrust. Those panels that she's talking about, I've sat on those, and I'm often the only white person in the room. And so I get a lot of the questions that are geared towards that. And it can get a little uncomfortable because folks are angry, and for many of them, they didn't even really understand what had happened. So they watch the movie and it makes them angry, and they have the right to be angry. So then we have to talk about what happened then and what's different now. How do we do research differently now? And how do you learn to tell a good research study from a bad research study? But a research participant should always feel like they're the celebrity in the room. right?
Yeah.
Because we can't do the work without them. And yes, they're contributing to science, and yes, they're helping their community, but ultimately we're asking them to do things that take time, take away from their life. And if they're low income and they've got a lot of other barriers going on, it can be really challenging for them. So we go to people's homes to collect data. We do anything we can do to get them in the study and keep them in the study. And they really do have to feel like the most important person in the room, because they really are. We can't do the work without them.
Right. I want to unpack what the study looks like more in just a moment,
Sure.
but I want to just kind of reset. If you're joining us today, this is a very interactive conversation. We'd love to hear your questions, hear your concerns, any personal barriers that you have as it relates to getting involved with research. Again, we've got the experts here today. So let's take advantage of this opportunity. Ask them any questions that you may have. From anywhere that you're viewing us, just type in your question or comment. We'll make sure to get that. We'll address that. Also want to show the enrollment form one more time. For those of you, again, who may have questions and you don't have time to stay around for an answer, again, take a shot of this enrollment form. Make sure you gather all that information. Go there with your additional questions. Go prepared. Go as a family. Because as JJ and others have already pointed out here today, it's extremely important that folks that look like us get involved in this research. That's the All of Us Research Program. Again, if we don't get involved, then we don't get counted. So when you go to the doctor and you're getting prescribed a medication and, well, doctor, this one's not working, so we've got to try another one. We have to keep trying different medications because we can't get precision medicine because, again, we're not part of the data collection. So, again, take advantage of the information you see there. So, Dr. Kitchman, I want to come back to you.
Yeah.
What exactly did the study look like? I decide, okay, I want to get involved. What do I do?
Okay. So before we go there, I just want to know, does everybody know how the study started?
No.
President Obama.
Now
No.
I know it's an Obama administration initiative that was implemented then, but I'm sure it was being investigated long before that.
No, well, it was the idea started from a man named Eric Dishman, who was the champion of all of us and the lead for a long time. He isn't anymore. And he had cancer starting in college. Through his 20s and his 30s, he had been on, 27 rounds of chemotherapy, some insane number. He actually came and talked to South Dallas, to our community, about his journey. And I think it was in his 40s, he was diagnosed, and they said, listen, you're not going to make it. There's nothing more we can do. And one of his science friends said, let's run your genome and see if we can find some genetic profiling of this cancer. And they actually realized that it was a cancer that the drug he needed had nothing to do with the cancer that he had. I can't remember which cancer it came from, but he took that chemotherapy that was for a different type of cancer, and he's been in remission for like 10 years. So it was his passion that everybody could have that experience, that they could benefit from precision medicine. So that's how all of us started. It was a very wonderful, noble idea, and now we're trying to make it happen, right? So when you join All of Us, you would get on joinallofus.org or that phone number that we presented. That's going to take you straight to the Baylor portal, essentially. And you can start your enrollment there, and we call that digital enrollment. You can also do it at any event that we're at. We can help you on your phone to get started. Once you've digitally enrolled, it will connect you to the closest clinic. So anywhere in Dallas proper, you'll be connected to my clinic. You make an appointment, you come in. It takes about an hour and a half. You fill out some surveys. You can do the surveys at home before you come. We take your blood, like 8 vials of blood, and anthropometrics, so height, weight, waist circumference, and that's it. And then you leave. And then moving forward, they'll send you some surveys. There's like 3 or 4 surveys a year that they ask extra questions. Tell me about the air where you live. Tell me about your experience with COVID. You don't have to complete the surveys, but if you have time, you can. And that's pretty much it. I mean, they'll reach out periodically. You can unenroll anytime you want. There's a button that you just hit that says, I don't want to be contacted anymore. I want to be out of this study. But yeah, it's a pretty simple process.
Okay.
And then data gets downloaded into your portal. So after you enroll, you can go back to your portal and they'll send you like ancestry and things about whether or not you like cilantro, which everyone's like, I already know if I like cilantro or not. Yeah. But as we progress, this is kind of like driving a bus while changing the tires, right? So this study started we didn't fully know, what we were going to get, how it was going to work, how we're going to get the data back to people. So that's all in process. I believe that the people that have enrolled in All of Us are going to get something amazing from it.
Yes.
We just don't know if that's going to be today or next year or the year after that. But I do think it's an amazing initiative to be a part of.
Yeah.
Do you have to give blood? Because I thought you didn't have to.
You don't have to give blood,
I mean,
but then they
obviously you
can't
would
do
want to.
they can't do your genomic sequencing. So then all of the precision medicine things that you could get back from it. I mean, because technically you should be able to get your genomic sequencing from Mayo if you want it. So let's say you are in a really bad medical situation and you wanted to get your genomic sequencing to a physician. Technically, you should be able to do that. It's not an easy process right now. They're kind of sending us back pieces and parts of the genetic, the genomic sequencing that they're finding. You can do saliva instead of blood, and there's at-home saliva kits that they'll send you. It's limited. You're not going to get the full benefit of the genomic sequencing if you only do saliva.
And it's only one time?
It's only one time.
Okay. All right, guys, I think we have a question that was just on the screen. I want to do, I think I could probably remember it. I don't see it there. But it says, I am currently a PharmD student at Texas Southern University. How can I get involved to help educate the community?
Nice.
Hey, young person wanting to get involved. So, Dr. Kitzman, I believe that would be for you. How do they get involved and help the community?
Yeah.
And then we'll come to JJ next.
Yeah. So, I mean, really, they can reach out to us at Baylor. You can call the 1-800 number and tell them you want to talk to Dr. Kitzman. I actually handle all of our community engagement. We have a community advisory board and a participant advisory board that we host every quarter, so they could join that and learn more about the initiatives that we're doing. Texas State is in San Marcos.
In Houston.
In Houston. We do have enrollment partners in Houston.
Okay.
So our Greek letter consortium has a good roadmap. So really the best thing would be to join our community advisory board. And from there, we can figure out how to tie you in.
All right. And if you would put that enrollment form, it's the same number that's on the enrollment form?
Yeah, they just call and ask for me.
Okay.
Dr.
So we've got
Kitzman.
that enrollment form up. That is 844-487-2794. All right, so they call that number. JJ, I want to come to you and talking about the Black Greek Letter Consortium. Talk about, I mean, there's a young person wanting to get involved. How do the young people get involved in this initiative to help move it forward?
Yes, with the Black Greek Letter Consortium, each of the 9 Greek letter organizations have representatives that's a part of BGLC.
Okay.
So and we have that information on all of their websites. So if they want to contact their representative for that organization, if they're Greek, they just contact them, and that person will get in respond back to them.
Okay.
So yeah. So if they're Greek, if they're not, they just need to contact us. They can go to the website. They can go to MPHC's website, the National Panhellenic website, and that information is there. So all of our information is on the website. All of the programs we've done are there. Even on our YouTube, we have that there. So if you go to the MPHC website, contact anybody there, and they'll get in contact with me personally, actually.
All right, good deal. Well, the questions are coming in now. Continue to send your questions. We're going to answer as many as we can. We have another question here. It says, why so many vials of blood? Is it because each blood samples measure study?
Okay, so why so many vials of blood? So I believe it's 8 vials of blood. It's supposed to equal 2 tablespoons of blood because each vial has some liquid in it that basically makes the blood stable so we can ship it to the Mayo Clinic. So we have to get it from the time we take it from the arm to the Mayo Clinic to process for the genomic sequencing is 24 hours. So it's not full vials of blood. Each vial is for a different type of test. And I think that's what they were trying to say.
Yeah.
So they have different liquids that are in each of those vials, and then that gets put into different testing categories. They also want to have some backup.
Okay.
Yeah.
So in regards to the blood, I actually signed up for the All of Us project when I started doing it. Or just participating in educating. I want to say it was about a year ago, and I have as yet to go give blood. And I haven't had time.
Yeah.
The reason that I'm even bringing that up is that sometimes, we have noble intentions, and so then we're not able to finish, right?
Yep.
So I did all the paperwork. I signed up. I am part of the communication. And that might be something I would encourage y'all to consider, because that is the first step,
That's great, yeah.
And then that allows you, because I know Thanksgiving is coming up, Christmas. No one's trying to figure that out right now, So, but once you get that on there, they'll send you a reminder and they'll keep in touch with you. And then maybe in January, when you get some time, you can then go down and go give your blood. And it doesn't have to be an all or none thing, because sure, if saliva that you do at home and just spit in a little, vial, it doesn't give you all of the information, that's still better than nothing, because, you can do that. And then when you get time, go do the blood. So I think it's important when you're thinking about doing something like this and you're like, oh my God, it sounds so amazing, but I just can't add one more thing. Just signing up online might be the one thing that you are motivated or inspired to do, because after hearing about it, you want to participate and do your part in the community. And then those next steps will fall into place. You just have to let it happen.
That's great. Yeah.
I think that's a good point.
That's a great
because
point.
Like you said, if you've got some questions that need to be answered for you, one of the best ways to get your questions answered is to enroll and get the information and then get it directly from the source, not from the barbershop or any other place. Get it directly from the source. Stephen, I saw a couple other questions. I think it was, does your primary care physician get access to your information? I think it's a great question. Do they?
No. So that goes back to confidentiality. So we don't share your information with anybody. Not even the federal government knows what data is connected with what person.
So there's no way to share that because you don't know.
You don't know. Okay. But you can ask for your data. You can pull down data from your portal and you can share it yourself with your primary care provider.
Okay.
When we started enrolling 3 years ago, it was you can get your genomic sequencing and you can share that with your provider. That hasn't quite happened yet, but it will happen in some way. But that data that you provide is your data, and you can get it and you can share it.
Okay.
So I would have answered it as yes, because you just said that you can.
Yeah, just not directly.
Yes.
Well, because if you download it from your portal, but I want to go to this next question because we're quickly running out of time. Yeah, there we are. If I was diagnosed with a disease, how does being involved in the study help me with my diagnosis and treatment?
Okay, so that's a great question. It may or may not, right? So it's going to depend on what have we found at the time when you get diagnosed with a disease. We don't know what innovations are going to come out of all of us. So the point of all of us is to collect all of the data. And then people are going to be researching this specific disease and that specific disease and this genomic sequencing related to that disease and these drugs. So we don't know. I would hope that if you're diagnosed with a disease, by the time that happens, that there will be information that's come out of all of us that would be helpful and beneficial to you. At a bare minimum, your genomic sequencing should be helpful to you and your primary care physician if they know what to do with it. This is a whole new world, right? I mean, precision medicine is very complicated. Genomic sequencing is very complicated, and we're at the beginning of this frontier.
But I would say to that, I want to answer that too, because, from a PI's point of view, if you have a disease and we're managing and monitoring, we find other things at the same time.
Yeah.
So I'll have someone give me an urgent email like, oh my God, his blood sugar is 600 and he's there for COVID.
Right.
So your disease is COVID, you're managing precision medicine, but we don't not look at other stuff that when we see it, then we address it.
That's true.
So,
that is true. We've had all of us folks come in and give blood, and in their blood sample there's visible visible cholesterol.
Right.
And so we do reach out to them and inform their primary care physician.
And I wanted to ask you, to that question that the person asked, it may not help them directly, but if they've got a disease that they've been diagnosed with, so let's just say maybe cancer or something of that nature, them being involved in the research study then helps to collect the information that could help other patients later.
With that
correct?
same disease, yes.
Is that correct?
Yes.
Yeah, that is correct. But, I think you need to speak to the fact that, what is it going to do for me? Because, that is an important question.
Yeah, absolutely.
Why should I do something that is going to help someone? Ideally, yes. But to me, I think as she commented, that you will see something. It's like Christmas where you're not exactly sure what. Because I've had patients that I've literally said, I think this drug would be great for you on a research study. They have turned it down. And this one I'm talking about specifically turned it down because she didn't want to get an injection, right? A year later, The drug was supposed to prevent her from having a stroke. She had a stroke because she was not in the research study. She ended up having a stroke, and they put her on that drug. Now, I mean, that was unfortunate, right? Because we could have potentially prevented that. And in that same way, when you are having information, especially in a longitudinal, which means over a large amount of time, and so many things are being looked at the same time. So when they start to see information and they're gathering it, then it can literally help you without you knowing, because that science is revolving behind the scenes. Yes. So you might not know that it helped you, just like that man who was like, oh no, I don't want to help. But I was like, but we all helped you, you know? Then when they get that information, they bounce and piggyback that off, and they're doing research in other areas at the same time. And so it did indirectly help you. Does that make sense?
It makes perfect
sense.
So,
but you might not be like, oh, well, they didn't give me any information. They didn't tell me anything. I didn't know anything. But that's just not true, because in the background, we're all working to help you.
Yeah.
Yes.
So it may be even more of an incentive to get involved. I saw one other question. I want to try to get as many of these in as we can. This question says, I was a volunteer for a research group for depression. This happened about 6 years ago. They did the genome sequencing. I don't fully understand how that works. I've been hearing about the HeLa cells. Is this the same thing? Do they use my cells as well? Thank you. Who wants to take a stab at that one?
You want to go for it?
Well, I don't know what y'all are using.
All right. So, okay. So with the genomic sequencing I don't fully understand it as well, right? So they do genomic sequencing. They're looking for all kinds of different traits in your genes that could be associated with a disease, could be associated with an epigenetic thing from where you live and a gene that you've had or that you have. So in the depression study, they were probably looking for a specific gene that was associated with that depression or that type of depression that they were studying. So I don't know the study that he was in, but he should be able to reach out to the principal investigator and get information on that. One of the things that we work really hard to do is every time we do a research study, we push that data back out to our study participants at the end. We say, this is our findings. These are your specific findings. We always give them a report at the end. That's not common, and it's something that we need to do a better job of, I think, in the research community, so that folks do know, what did my data contribute to?
But we don't know necessarily what it means. That's
true.
Think
That's true.
People get confused about. Yeah. They're like, well, what does this mean? Well, we don't know, because we're researching it.
You're very right.
We're trying to figure out what does that mean.
You're completely correct.
So you ate broccoli and you didn't get cancer. Does that mean that broccoli prevented your cancer? Or was it because you lived in South Dallas and that was what was the preventive? I mean, living somewhere can not only cause you to get disease, but it can cause you not to get disease. Like if you're living in Jamaica on an island and you're like just having a good time and you don't have stress and cortisol and all that, hell, you might not have cancer. And then that's what we're going to find out, Yeah. So I think that's something we're going to be doing, a depression study with EEGs where they study your brain waves, because a lot of depression studies are just like, hey, let's try this drug and see if it works, but we don't have any data on, what it is, like genomic studies or what biomarkers or what your brain activity, is it I mean, what's going on with your brain that's causing you not to be able to keep it all together, A
great way to illustrate the point.
So the HeLa cells, though,
before Halloween,
he did bring up. He asked about the HeLa cells, and so that's a different thing. Henrietta Lacks, they were taking, which they still do. They can take cells from you from surgery and use them for research. It's typically in your consent. It's de-identified. So it was one of those situations where her cells were the first to replicate. And by having them replicate, they're then able to use those cells to test all kinds of different things. So her cells were basically the cell lines that are in all of our laboratories today, where we test things out to see what happens to that cell when we add something or take something away.
Okay.
So that's different than your genomic sequencing. Your genomic sequencing is to figure out, do you have specific, there's hundreds and hundreds of genes, right? So do you have a specific gene variant that's connected to, in his case, his depression, that makes a certain treatment work better or not for you.
Yeah.
So there's treatment-resistant depression.
Yeah.
That's a genetic variant of a depression. So much of depressive symptomology and mental health is genetically related or epigenetic, meaning your environment and your genes interacting.
Okay.
So it's a little different. The HeLa cells are actual cells that grow in tubes. Your genomic sequencing is your own genomic personal fingerprint, and it is connected to everything that is happening in your body, from diabetes to depression to how many calories you burn a day. That's all part of your genomic sequencing.
Okay.
Does that help?
It does. It
Okay.
does. And you said something a moment ago, and I want to make sure we kind of do a reset.
Yeah.
You talked about if, in fact, you've ever been involved in a research study and you didn't receive your information, contact the
Principal investigator.
Principal
so
investigator.
the principal investigator is listed on your consent form. Always keep your consent form when you sign a study. They'll give you a copy. If they don't give you a copy, you need to ask for a copy. And it has the PI's name, so that's the lead scientist. And it also has the phone number to the institutional review board. Those are a group of objective people that make sure that we aren't doing anything unethical or harming humans. So if they have a concern about the study, they can contact both the PI but also the regulatory body. And so those phone numbers are both in that consent form.
Okay.
Studies don't have to give you your information back, but I think it's good customer service.
Yeah.
We want people to understand what's in it for me. There should always be a what's in it for me.
Yeah.
We can't expect people to just altruistically contribute to science unless they're just super awesome people, and they exist, right? But most people need something that's in it for them.
Yeah.
And that's okay.
All right. Well, if you just join us, you're listening to a community conversation about health and research. Joining me today is Dr. Heather Kitzman, Jennifer Jones, and Dr. Chrisette Dharma. It's a partnership here today between Chris Howell Communications and the Community Council of Greater Dallas, and in collaboration with the Black Greek Letter Consortium and I should have my note right here, the Southwest Family Medicine, also headed up by Dr. Dharma sitting right here. The fly young lady with the glasses on. So again, we're having a great conversation. And we are taking your questions. If you just logged in, we still have time for your questions because, again, this is important that you get your questions answered because we do want you to participate. We'll show that enrollment form one more time. We just really trying to make sure we do our part with the All of Us research program to get 1 million people involved. So I want to come back to Dr. Kitzman. How many people have you guys enrolled total?
At Baylor?
Yes.
It's about 38,000 was the number.
38,000.
That
And what's your goal?
As many as we can get.
Yeah, get as close to that million as possible.
I
right?
mean, we're going to contribute some percentage of that million.
Yeah.
We have recruitment goals. I think this quarter we're trying to get 300 people. And my job is to make sure that we get people in South Dallas, that we're partnering with the right people. We have the right people out in the field, which is not me. It's pretty funny when I try to get someone of color to give me their blood. They're like, oh, no, lady. So I'm like, oh, I get my staff over there. Talk to her.
So, JJ, I want to come to you now. The Black Greek Letter Consortium, you guys, and you personally have been doing a lot of work, Community Council of Greater Dallas. You've got an event scheduled even later today, so you are really passionate about this. Let's talk about the event you have later today and why you're so passionate about this work.
Absolutely. So we are having our National Panhellenic Conference that we have every 2 years. And so today I am doing a piece on the All of Us research program, and we're having our influencer, who is Judge Mathis from Judge Mathis' court daughter, Jade Mathis, is going to be talking about mental health. She's telling her story, and she's going to tie it into the All of Us research program.
Nice.
Wow.
So yes, that's happening today at 2:25 Central Time.
Yeah, so you were really doing your part to help get close to that million mark as well.
Yes.
Yeah,
yes.
absolutely. Well, Dr. Dharma, I want to come back to you. Being a PI, give me the title one more time.
Principal investigator.
Being a principal investigator and physician yourself, talk about the importance of getting Black and Latino people involved in the research study.
Yeah, I mean, as we've already, talked about, and just to hit it home, if you do not participate in some form of research if you don't participate in research, you will not get medicines that will help you. When cancers come out, with hypertension, with diabetes, you are only hurting yourself. I don't think that's a motivating reason for them to do it, but I think that they have to understand that, when you are angry, because you feel like your voice is not heard, and you're like, well, why is it that when there, I'm trying to stay politically correct. So, well, I just don't want to like incite people. But I mean, I do not want to do that. But I mean, I tend to be a little, okay. So, but I feel like people feel like they voice is not heard, and that that we are not paying attention. My daughter actually created an organization called the Invisible Woman Foundation because of the higher incidence of morbidity and mortality in African American women during childbirth. And when you look at the numbers, it is so ridiculous how medicine kind of covers all this stuff up. And we don't bring it to light, right? And the reason I bring that up is because people are angry because, African Americans don't have the same health care. I mean, I see you in my office, you have medical insurance, and yet you don't utilize it, and then you don't get the same health care, even though why? You have the same Blue Cross Blue Shield, So it starts from implicit bias, racism, poor access to care, all of the... Yeah, I mean, all of it.
Mistrust.
But then it also goes into the fact that when you weren't participating in your health, like JJ's talking about, and you weren't involved, you didn't ask questions, and then you didn't do the research that, I have Caucasian patients who are like, oh, have you heard of this? I'm like, oh, no. And I have to go look it up because they are so ahead on wanting the newest, most advanced medicine. So when you ask me that question, I would say empower yourself, seek out physicians and resources that advocate for you so that you are not left in the dust. Like sometimes I'll have patients who come to me and they are on some old school, tired 1950s regimen. And I'm like, what is going on? When I have other people who have great outcomes and like great access, and it's just like they weren't even told about it. I was reading an article from Sanjay Gupta on CNN, and it was saying that even doctors don't know about monoclonal antibodies, and they don't offer it to patients, and they don't offer it to people of color because they assume that they don't want it, and so, well, why would they not want it? I mean, I want to be saved just like anybody else. And so there's all these layers and layers
So
and
much.
layers,
So many layers.
Of crap that, you just kind of have to dig through it and have honest conversations with people you trust. And research is like a fundamental beginning to getting the advances that you want in your community so that you are seen. You need to be seen. You should demand to be a part of the conversation, and that it is your right to have us as physicians, as your healthcare workers, advocate for you and not just not care about you,
Yeah.
So.
It's like I said, another way to allow your voice to be heard. As we almost come to the end here, there was one other question. I just saw a question. Says, are there trials for those that have a particular disease, sickness, based on the drug, or just open to anyone? Another good question.
So for all of us is open to anybody. And then Dr. Dharma, the studies that she's doing are for specific diseases.
Yeah, they're very, very specific in order, because if it's too general of a question, then you can't find the answer. And we are now into precision medicine. And I think if you're a girl, you'll understand this. When you go get your makeup matched, you want a shade of under yellow for brown, not pale pink for brown. Because, I mean, it makes a difference. Precision medicine, using big words like your genome, your biomarkers, all of that stuff. I mean, but you understand that you want something created for you that makes sense for you. And so...
You want your suit to fit.
Yeah.
Yeah, there you go.
If you're a guy.
Nice way to include the guys.
Okay.
You want your suit to fit. I mean, and we don't know. We don't know what's going to come from this study. And as Dr. Dharma pointed out, like that's what science is all about, right? There's no definitives. These are all questions that we're trying to get answers to, and that's how we get the next new innovation.
Yeah. All right. 11:08, so we're about 7 minutes into the before we end the program. But again, want to take this moment. Any questions you have, this is an opportunity for you to get the answers to the questions that you have. You've been maybe thinking about getting involved in a research study, but you've been hesitant for whatever reason. Here's an opportunity to ask the questions of the experts here today. So certainly give us your comment, your chat in the chat box there, and we'll make sure we get that answered before we go. Over at Baylor Scott and White, that's local.
Yes.
What can folks who are viewing from Detroit, other areas of the country, how do they get involved in the research study as well?
So if they go to joinallofus.org and start filling it out, it's going to connect them to their local HPO, so their health partner, or a local organization that can help them enroll. There's also digital enrollment where you just do everything online and they send you a kit in the mail. They'll only send you the kit in the mail for saliva if you're not near a enrollment partner, because they really want those blood samples because they are preferable for the genomic sequencing over the saliva. You're going to get limited. You're still going to get stuff, but it's not as good as the blood.
Okay.
So there's a way for everybody to join that wants to join. We want all of us. We want everybody. So yeah, I think it's a great study that you have to kind of wrap your mind around, that it's different.
Yeah.
You know, that we're not here to answer a definitive question about a definitive disease. All of us is about collecting the data so that all the leaders across the world in scientific areas and disease specialties can try to mine that data to answer questions.
Okay.
Just like the COVID.
Yeah.
They used it to find out that COVID was here in December. Any researcher that's a valid, reputable researcher can access the All of Us data for free and analyze this huge pool of data to try to find answers to our most pressing healthcare problems.
All right. Like I talked about earlier, we went out on the street. We asked some folks some questions. We've got one other video that I'd like to share with you guys, and we'll come back and unpack this one in just a second. Take a look at this.
The clinical trials or the research and ask them to actually take the medications or the vaccines as well?
No, I didn't know.
Take the medications? Is it something that you would do?
No,
Why?
I just don't trust it.
Why?
Why y'all? I just feel like it's an experiment. Yeah.
Okay.
Yeah, go and ask somebody else. Don't ask us.
Even if it's a paid study?
Nah, I'm not doing that.
Okay. What about you, sir?
Same thing. Experiment, same thing. Like father, like son.
Yeah.
What about the COVID vaccine? How you feel about that?
I still ain't got it, and I'm not gonna get it.
Same reasons?
Yeah, I don't care who got it. So.
Same reasons?
Same reason.
Okay. Thank you. Have a good day.
JJ, want to come to you, your reaction. He said, like father, like son. So it's a generational thing.
Generational of the lack of knowledge. I mean, and you receive those kind of messages as you grow up.
Yeah.
So if that's been embedded in your life, then you just stick to that.
Yeah.
My mother, well, she died when I was 21, but I didn't know what kind of cancer she had because, again, it was all over. So, and I wouldn't have known to ask those questions, and she didn't talk about that. And I think she was diagnosed 8 years prior, now with knowing what I know, because she was diagnosed, she was to have surgery. She decided to go to another doctor, went to another doctor, she was pregnant. But I don't think that stopped the tumor wherever it was at that time. But I was 13. I didn't know to ask a question. I have no one earthly I did ask her the question. And then after that, this is just so weird that after she had my little sister, she became pregnant again. She carried whatever that was for 10 months. She started hemorrhaging one night. They took it to the doctor, to the hospital, and whatever it was, they took it from her. And some kind of study was done. She has a identical twin sister, my aunt. And I said, what was that ever, because I heard the sidebar, like it was something that they took. And I asked my aunt, what was it? She said, we never found out. So nobody ever went back to find out exactly what that was that they took. And we just don't know. But if that's your history and that's your story that you're telling, if you have a parent that's saying, I'm afraid to go to the doctor, of course you're going to be afraid.
Yeah.
So yes, but we have to break the cycle of ignorance. That's what I'm going to call it, because that's what it is.
Yeah.
Because we just don't know. So.
Yeah. Dr. Dormer, as we round this corner to land this plane, you saw the video. What do you suggest we do to try to help overcome these personal barriers, if you will, of getting involved in not just research, but like, JJ just talked about, sometimes just even going to a regular doctor visit?
Well, I mean, I think the first thing is to find someone that you trust that's good. And the best way to do that is not on Facebook or Instagram, but talk to your friend. if your friend has gone to some doctor and they recommend them, I think 90% of our referrals are from a friend of a friend, and they'll be like, oh, my girlfriend went to you and she said you were fly. And I was like, yes, I am. No, but I mean, because if I saw on our Facebook, we have like a bunch of common friends, so you're going to end up liking someone and trusting someone. So they've already done the research for you. And like he said, like father, like son, we're family medicine. And so we have a lot of families of more than 5 generations. I'm not going to date myself, but I have, kids who now they're in college that I saw and was their pediatrician, and so I think trusting physicians is really important. We are really advocating for primary care, and it just happens, and that's why in our research site, which is one of the ones that gets a lot of minority patients, because we're not a site where you just go, you don't know the doctor, someone's just trying to get blood and you're just being experimented on. It's like, I just saw you on the other side. I talked to you. I've known you for 15 to 20 years, and I'm not going to do anything that is not in your best interest. So when I ask you to be in a study, then most of my patients are like, yeah, I trust you. Yeah. And because they should, because there are many people that I don't even give that opportunity to because I don't think they're well enough. I don't think they're good candidates. And most PIs are good people. But, again, I can't testify, for everybody. But I think a trusting relationship with your primary care doctor is the most important. And even when you talk to them about research, before you join a research study, you can talk to your primary care doctor. Mm-hmm. And then as Dr. Kitchener was saying, we can give you the information from all of us to go to them, just like on your portal. Like if someone goes to Parkland or UT or Baylor and I don't have the information and I can't get their records, they can just put it on their portal and then show me. So all of those advances in science and technology allow us to help you live a healthier life. And really, that's what we're all here, spending our Saturday morning trying to get y'all just some true information, like unpack it. I love that, unpack all the crap to get to the truth, know?
Yeah.
I want to make sure that people know that even if you don't have insurance, you can still get a primary care doctor. Yeah. So Baylor has 7 Baylor community care clinics where you can go and get access to a great primary care doctor without insurance, and Parkland as well, the COPCs, you can get in there.
All right, good deal. As we get around the corner, we've got a final question in here. It says, if you get COVID after being fully vaccinated, can you still get a monoclonal antibodies infusion?
Yes, you can. And not only that, you have to get it within 10 days. So that's really important. And now you don't have to only get an infusion. At our office, we give the shot. So it's much easier to get to. Yesterday, someone actually took me out I kind of saved their life earlier this year. It was a nice steak dinner. But what was the problem was his doctor didn't have the monoclonal antibodies, and he researched, and he drove all the way from like Denton down to our office to get the monoclonal antibodies. So the key is to get it in 10 days because the spike protein is where it binds to. And so if you wait, a lot of times people are like, well, my friend got it and they were fine. They just didn't have a little taste. But you don't know what's going to happen to you. So you need to jump on it early. And so I think that's really important. And then the last thing I would say is make sure that if your doctor thinks that you are not a candidate, that is just not true, okay? Because the BMI of greater than 25 is all you need to meet criteria. And that's a really important thing. So I just want to hone in this for 1 second because a lot of times people are like, well, if you don't have any health conditions or if you're not over 65 and you look like you're fine, then they're like, well, you're not really a candidate. But now that's what the article I was talking about from CNN, that you are eligible. And I am a BMI of 24.8. I'm not overweight, but I am able to get it because if you're over 25, you can get monoclonal antibodies. So a lot of people look at you and think, oh, okay, well, you're not a candidate. You don't have diabetes diabetes or hypertension or any of that stuff. So I think it's everybody basically is a candidate is what I'm saying.
Okay.
If you get sick, go get it, because it will change everything. The outcomes are amazing. We did trials on it. They showed like really great results, and everyone that we're giving to, President Trump got Regeneron, okay, in a clinical trial before it was available. I don't think a lot of people know that, because by the time monoclonal antibodies came on the market towards the end of that year, he had gotten sick ahead of time and it was not out on the market, and he got it ahead of time, obviously because he's the president, but it was like a trial in the sense that it was not readily available. So the medicines that we are able to give you in clinical trials, people who have influence and money, they go get whatever they want, and then you think we're testing you, but we're giving you these advantages to hopefully make a difference, but you don't see it in the light that people with money do, because they're like, well, what's the latest thing? Because I don't want this crap. I want you to take HCQ, good luck, but I'm going to go get Regeneron, which is the monoclonal antibody that's out now. So please, I think that was a really good question. And I hope that someone heard this, so that if your friend or family is sick, make sure that they look online and they can get it. We do have it at our office, and so we are giving it out to patients of ours or anyone.
Okay, good deal. So you said within 10 days, so that means as soon as you lose taste or smell, be diagnosed with COVID within the 10 days of your diagnosis, I guess.
Correct.
Okay, good deal. All right, any final thoughts before we close out?
No, just thank you so much for having us here and having this conversation. And I hope if just one person is motivated to join all of us, or be more open to research in the future, I think it was well worth it.
Yeah, absolutely. Any final thoughts for me?
Agree. Be a champion of your own health.
Yeah, I like that. Be a champion of your own health. That could be a bumper sticker or hashtag, T-shirt, something.
Absolutely.
I like that. Any final thoughts?
You can make a difference.
Yeah.
I hope all my patients consider it, and I'm going to have some more information on there for it, so that, I know that they are good people and that they want to participate in making a difference. So I'm going to advocate, be an ambassador. If you are, interested, the more you talk about it, they don't care what we think. They care what you think, so if you are in it or are willing to do it, and then you do it, and then you tell somebody, then that's really where we're going to see some movement. So I would say be involved, make a difference, and be an ambassador.
Absolutely. I so totally agree. And again, thank you for those of you who joined us today. Again, it's been a community conversation regarding health and research, a partnership between Chris Howell Communications and the Community Council of Greater Dallas. Again, for more information and to catch the full replay later today, you can go to the Community Council of Greater Dallas website. That website is ccadvance.org. That's ccadvance.org. We're going to put up the enrollment form for you one more time, an opportunity for you to be part of the All of Us Research Study Program. Again, you've heard from Dr. Kitzman today. When you get involved in the program here at Baylor Scott & White in Dallas, you'll be working directly with Dr. Kitzman. If you're outside the Dallas area, then we hope that you'll get someone who's just as effective and efficient as she is to help you through the research. But again, thank you for watching, and it's been a great joy to bring it to you. Have a great day.